Allison, and this is my model Josie. I'm going to be performing my lower quarter screening exam. So the first thing I'm going to start with is the lower quarter movements. It's really important that I look at them functionally and seeing how they move. I'm going to focus on the squat as well as forward and backward bending. Josie, so first thing I want you to do is I want to see how you squat, okay? Squatting is really important with your movement, with working, lifting things, and I'm just looking to see how everything's moving or if there's any compensations, okay?
Okay.
So you're gonna have your arms straight up over your head, feet shoulder width apart, and I just want you to go down as low as you can, don't push through any pain, and come back up. You go ahead and relax. I'm looking for any forward bending with the thoracic. I'm looking for valgus collapse in the knees. I'm looking for arch collapse. I'm looking for asymmetrical weight bearing as well. All right, any pain with that?
A little bit when I went down.
A little bit when you went down, okay. So the next thing I'm gonna have you do is you're actually gonna turn facing the wall. I want you to put your hands on your hips and you're gonna lean back as far as you can. Don't push through any pain.
That's pretty good.
Is that still okay? Okay. So the reason why I didn't have the patient's arms up over their head is because the patient is already in an exacerbated state. I felt like this could maybe help brace a little bit more. Now you're gonna put your hands down in front of you and I want you to bend as forward as you can. Again, don't push through any pain. Okay, then come back up. How'd that feel?
A little hard to get up.
A little bit hard to get up, okay. So there I was looking for the lumbar spine, if there was any flexion there or if it was pure hinging at the hips. I'm also looking to see how she was getting up, how she was kind of like crawling up the hands. It could be for support, could be for instability. All right, Josie. So next we're gonna have you sit down on the table. I'm gonna do a little neuroscan. So this is just gonna help me kind of identify, this whole screen that I'm doing is just kind of helping me identify, making sure you're appropriate for therapy. It's gonna help me pinpoint kind of what's going on so we can take a deeper dive a little bit later, okay?
Okay.
So the first one we're gonna do is assess your strength. So what I want you to do is lift up your knee nice and high. I'm gonna apply resistance. Don't let me move you, okay?
Okay.
Good. Bring that knee up. Hold. And if any of these are causing you pain, please let me know. Good. Now what I want you to do is straighten this leg out. Relax it just a little bit. Hold. Good. Straighten this leg out. Relax it a little bit. Hold. Any pain with these? Okay. Now I want you to bring your ankles up. Hold right there. Good. Up. Good. Toes, I want your big toes up. Good. Big toe up. Good. I could also do toe walking and heel walking. That could give me an idea of S2. I'm expecting to find weakness with ankle dorsiflexion and potential great toe extension because I'm thinking maybe this is an L4, L5 disc herniation, and those are the myotomal patterns. Okay, next I'm gonna assess your sensation. This is gonna tell me if there's, I wanna know if there's any abnormal feelings down your legs, okay?
Okay.
So this is what it's gonna feel like.
Okay.
I want you to tell me if it feels the same or if it feels different.
Okay.
You're gonna close your eyes. Ready?
Same. Same.
Oh, do you mind taking off your socks for me?
No. Not at all.
Thank you. Okay, ready?
Mm-hmm. Same. Same. Same.
Perfect. I'm not expecting to find any abnormal sensations. Okay, and lastly, I'm just gonna test your reflexes, okay?
Okay.
Good. And I could do both sides. If I see any hyperreflexia again, that could kind of pinpoint which, if there's any abnormal lower motor neurons going on. Okay. Lastly, since she wasn't too flared up, I am going to perform a slump test. I am expecting to find positive findings with this. So Josie, this last one I'm going to look to see if there's any dural tension. So if there's any tightness in your spine, Since you're having pain going down your leg, it's going to give me a good idea of what's going on, okay?
Okay.
So this first one, what I want you to do is bring your chin down to your chest. How does that feel?
Feels okay.
I'm going to put some pressure on your head. Okay. You're going to put your hands behind your back. Now I want you to fold over my hand. How does that feel?
Feels okay.
Okay. Go ahead and straighten this leg out for me. Do you feel anything with that?
Yeah, I feel tightness back in my leg.
Bring your head up. Does that make it go away?
Yeah.
Perfect. And then bring it back down. Go ahead and relax. Okay, so we found some range of motion deficits with your back when you're bending forward. That's common for disc pathologies. When you bend forward, that puts a lot more pressure on the disc, which is actually putting pressure on your nerve.
Yeah.
But then when you come back, that actually gives it nice relief. So what we're going to do is we're going to follow up with some exercises. We're going to go to do a deeper dive down at exactly what level is going on and get a better idea of what's going on.
Cool.